You know, in any industry where safety is everything, drug testing isn't just some box you check on a form. It's a critical part of a culture that actually protects people's lives. But what happens when the integrity of that test gets called into question? Well, today we're pulling back the curtain on the hidden science that ensures a fair and accurate result. And it's a science that, honestly, every safety and HR manager really needs to get their head around.
Okay, I want you to picture this. An accident has just happened. You see the flashing lights, you feel the adrenaline pumping, and you've got this urgent need to follow protocol. If you're managing a fleet or a team, you know this feeling. It's that moment where the pressure just goes through the roof. You've got a very limited window to comply with regulations, make sure your driver's okay, and get a drug and alcohol test going. Every single decision, every minute is absolutely critical. All right, so here's our game plan for this deep dive. We're going to start with that intense post-accident pressure cooker. Then we'll get into what I call the dilution dilemma, this whole cat and mouse game of sample tampering. After that, we'll dive into the pretty cool science that keeps these tests honest, learn how to read the results, and talk about that tricky gray area between medical issues and actual tampering. And to finish it all off, we'll see how modern tech is completely changing the game.
So let's go back to that accident scene. That immediate aftermath is just a whirlwind of things you have to do. And look, you're not just dealing with the logistics here. You're juggling strict DOT timelines, trying to handle any legal risks, and most importantly, you're trying to uphold the safety of everyone involved. The clock is ticking, and the need for a clear, accurate, and totally defensible drug test is just non-negotiable.
And this is really the heart of the matter. An unreliable test result? That is actually worse than no test at all. Seriously, it could mean an impaired driver gets back on the road, which could expose your company to huge liability and, frankly, devastating consequences. It just undermines your entire safety program and destroys trust. The stakes really couldn't be any higher, which is exactly why the system has built in checks to protect against one of the biggest threats out there.
So let's talk about the elephant in the room, sample tampering. An employee who might have something to hide could try to cheat the test. And you know what? One of the most common ways they do that is through dilution. This is where a simple compliance procedure can turn into this huge, complex challenge of trust and, well, verification. So what are we talking about here? What is sample dilution? At its core, it's a pretty simple and kind of desperate idea. If you can water down the urine, maybe you can also water down the concentration of a drug metabolite so much that it falls below the lab's detection limit. It's a calculated risk to try and make the sample invalid, or what they're really hoping for, a false negative.
So how do people actually try to do this? Well, the most common way is just chugging a ton of water. We're talking 24, maybe 36 ounces at once, about a half hour before the test. That can dilute a sample by a factor of 10. Others might try a more direct approach, like secretly adding a little water from the toilet into the collection cup. And then, of course, you've got this whole industry of so-called detox drinks, which are basically just expensive, vitamin-packed ways to do the exact same thing: flush the system with liquid.
And for any manager out there, you know how frustrating this is, right? You're just trying to follow the rules, keep your workplace safe, and make sure you're complying with the law. But now you have to worry about the possibility that someone is actively trying to cheat the system. It adds this whole other layer of complexity and suspicion. But the good news is, science has an answer for this. And this is where we get to shift from the problem to a really elegant solution. See, labs aren't just looking for drugs. They're also testing the sample itself to make sure it's valid. And their number one line of defense against dilution is a powerful but beautifully simple scientific test, the urine-specific gravity test. To put it simply, specific gravity is just a measure of concentration. The test automatically checks how dense the urine is by comparing it to the density of pure water. Think about it. Normal, healthy urine is full of all sorts of stuff: waste products, electrolytes, and that makes it denser than plain water. A diluted sample? Well, it looks a whole lot more like water because, well, it mostly is. It's a brilliant, built-in check that happens on pretty much every single urinalysis. Okay, to make this super clear, just think about the difference between a glass of fresh water and a glass of salt water. The salt water feels heavier, right? It's denser because it's packed with all those dissolved salt particles. Urine works the exact same way. The lab uses pure water as its baseline, its starting point. So a sample that's too close in density to pure water, that immediately throws up a huge red flag that it might have been tampered with. All right, so the lab runs the test and they give you a number. But what does that number actually mean? It's not just a pass or a fail. These numbers tell a story about the sample's validity, and they can even give you a hint about the donor's health. This right here is the key range you need to remember. A typical valid urine sample is going to have a specific gravity somewhere between 1.005 and 1.030. This is the range that labs are looking for. It's their gold standard. Now, if a result comes back outside of this window, either too low or too high, it doesn't automatically mean somebody cheated, but it absolutely means a medical review officer is about to take a much closer look. So what are these extremes telling us? On one hand, you've got a low specific gravity, something below 1.005. That points right back to that dilution problem we talked about, either from someone trying to cheat or just from drinking way too much water. But here's the key, it can also be a sign of kidney problems or certain medications. On the flip side, a high specific gravity above 1.030 usually just means the person is dehydrated. But it could also be caused by things like diarrhea, vomiting, or even too much glucose in the urine, which might point to something like diabetes. See, this one test gives us a ton of information. And this brings us right to the real-world headache for any manager or HR pro. An out-of-range specific gravity result isn't a smoking gun. It's really just the start of a very careful conversation, because there are completely legitimate medical reasons why a sample might look diluted. Just take a look at some of these reasons. Renal disease directly messes with the kidney's ability to concentrate urine. If someone's on an IV drip for dehydration, their urine is naturally going to be diluted, and certain medications, like diuretics for high blood pressure, are literally designed to make you flush out more water, which of course lowers the specific gravity. These are all totally valid medical situations that can give you the exact same result as someone trying to cheat. And honestly, this is where it gets really tricky. You have a duty to enforce your company's drug-free workplace policy, but you also have to respect an employee's privacy and potential health issues that are protected by law. It's a very delicate balancing act. So how do you approach that conversation? How do you work with a medical review officer to get the answers you need without crossing a line? I would really love to hear your thoughts on this. Drop a comment below and let us know how you handled this complex gray area. Okay. We've talked about the pressure, the problem with dilution, the science that catches it. So how do we put all this together in that high-stakes, post-accident situation we started with? Well, modern technology now gives us a way to bring order, speed, and total clarity to all of that chaos. I want you to go back to that scene. You're on the side of the road, it's maybe the middle of the night, you're in a town you don't even know. The DOT clock is ticking away. You don't have time to be flipping through a binder or making a dozen phone calls desperately trying to find an available mobile collector who can actually get there in time. You need a solution that is just as immediate and serious as the situation you're in. And thankfully, that old way of just scrambling and hoping for the best is being replaced by technology. Technology that brings a streamlined, transparent, and incredibly efficient process right to the palm of your hand, wherever you are, whenever you need it. And this is where dedicated apps, specifically designed for this exact situation, are just changing the game. Imagine a platform that gets rid of that late-night scramble by instantly connecting you to a whole network of vetted mobile collectors. You'd get real-time updates and could even use detailed geo-fenced tracking to watch the collector's progress on a map. This kind of tech streamlines the entire DOT compliance process and can even help boost your company's overall safety score. And look at how simple the process becomes. An accident happens, you just open the app on your phone. It can even walk you through the DOT criteria to take the guesswork out of whether a test is even needed. Then, with a single tap, a mobile collector is on their way to your exact location. You can see their live ETA, which takes all of that stress and uncertainty out of the equation. And finally, you get the secure, compliant results delivered efficiently, closing the loop on a crazy event with clarity and control. And at the end of the day, that's what this is all about. It's about using technology to empower businesses, to make compliance simpler and more reliable, and to create a safer environment for everybody. It's about using advanced patented tools to turn a moment of crisis into a moment of calm, confident control. So I'll leave you with this one last thought. For way too long, post-accident safety has been all about reacting to bad things after they happen. But with the right tools, we can completely shift that way of thinking. So how can technology like this transform your safety protocols? How can you move from just reacting to incidents to proactively managing them with speed, with data, and with confidence?
If you were inspired by this video, please do us a huge favor and like and subscribe to our YouTube channel, Rady Collect. And hey, feel free to share this video as well. Thank you.